My name is Dr. Jim Kokkinakis, Principal Optometrist of the eye practice in the Sydney CBD. In this video we'll be discussing dry eyes, its causes, symptoms and all the possible treatments that are available to us. Dry eye syndrome today is an absolute epidemic. It affects nearly all of us, and in this digital world we're now in a situation where more than half the population is suffering in some form of this condition. It's very, very irritated eyes, and let's face it, eyes are very sensitive and consequently it can take over your life. Common symptoms are severe discomfort, burning, gritty. Funnily enough, ironically, it can even be excess watering of the eye. The eye ends up so irritated that it just floods itself with bad quality tears and makes life miserable. The main causes of dry eye is excessive use of digital devices, in my opinion. This occurs due to concentrating on the digital device to such an extent that your whole blinking mechanism is paralysed, and dehumidified air ends up in your eye and dehydrates the surface. It basically will feel like you're blinking on sandpaper. And maybe even poor diet combined with excessive indoor activity and not enough sun. The three components of a tear film include the oil, which is called the meibum, that is created by the eyelids, the aqueous or the water component, which is created by the lacrimal gland, and the mucus, which is created by the goblet cells on the white part of the eye that's called the conjunctiva. You combine the three together and you end up with a good tear film. The eyes blink continually 12,000 times a day on average. Believe it or not, the average computer operator today probably only blinks 3,000 times a day. So that's 25% of what's actually normal. The blinking mechanism stimulates two main glands, the oil glands in the eyelids that are called the meibomian glands. They create oil, which of course any machine without oil will suffer from grinding and let's call it irritation as far as the eye is concerned. And also the lacrimal gland, which creates water. There's a combination of these two things, plus mucus, and then you end up with a great tear film. If you don't blink properly, you end up not creating that tear film that you require, and then of course the cascade of irritation then just spirals out of control. If the eye is dry, it makes sense to wet it, right? Unfortunately, it's not that simple, and let's face it, there's no eye drop on this planet that even comes close to your tear film. Blinking is what creates a tear film. No blinking, no tear film. And then what we then do, of course, is we end up in the pharmacy, they give us a lubricant, and we just flush whatever tear film we have straight out. And in fact, we can perpetuate the problem if we excessively use lubricants that we buy from the pharmacy. Yeah, I think it's important that they nearly feel lost, because dry eye in its first instant is actually quite benign. It's just a slight irritation, it comes and goes, it's not interfering with your lifestyle too much, so it's just a simple thing to just go to the pharmacy. But let's say now it's increased to the point where you think to yourself, hey, you know, this is starting to interfere with my lifestyle. These drops that I've just had from the pharmacy are really not doing too much. Well, then that's when the time comes for the very comprehensive eye examination that's specifically tailored for dry eye. Dry eye, as I said, is a specialty, and you really need, there's a lot to it and a lot of testing that needs to be done in depth to get to the bottom of the problem. The dry eye treatments that I tend to offer, I tend to start simple first. I don't dive into complicated solutions when simple solutions are appropriate. So I think if we break up dry eye treatment maybe into three stages. Stage one is the stuff that you've got to keep on doing ongoing. You've got, the analogy I tend to use there is like dental hygiene. We brush and floss our teeth hopefully every day. Well, there's going to be things that we do for dry eye management that is essential that we do on an ongoing basis. And that includes blinking. Gentle finger massage on the eyelids is we basically just press on the eyelids so we can stimulate the oil into the eye, and followed by blinking. Often the oil glands are actually congested and the oil has become congealed, so we say that we should be doing warm compresses to try and melt that oil and make it easier for it to flow. Those two things are the absolute foundation. That's like brushing and flossing teeth. Depending on how inflamed the eyes are, we might introduce medical treatments such as topical steroids, topical cyclosporin, which is an anti-inflammatory. There is dietary changes that we probably should think about, such as fish oil, to try and create a better oil balance in your whole body, and exposure to sunlight. We're a society now that is afraid of going out into the sun, and many studies have shown that exposure or some exposure to sunlight will stimulate the oil glands to function in the eyelids better, and we're really missing out on that as well. So if you do the basic stuff first, see what the response is. That can take up to 3 months before we really are in a position to add any more sophisticated treatments. And in my opinion, that it's not a good idea to jump into more complicated solutions until we've exhausted the simple things. So we've got blinking, we've got finger massage with warm compresses, we've got exposure to sunlight, we've got dietary supplements such as omega-3 supplementation. We then move on to things like IPL, which is intense pulse light. That tends to stimulate the oil glands. LipiFlow, that's a very sophisticated procedure, but it's probably the premium procedure to consider when the oil glands are congested. There's MyBiflow. That's a very sophisticated warm compress. And there are other things that are coming out now. We'll be looking out to incorporate these new treatments as soon as they're available. Definitely there's hope for dry eye. One thing we need to be clear about is trying to manage a person's expectation. The longer they've had the problem, the longer it's going to take us to turn things around. So it doesn't happen overnight, but you stick to the advice and I guarantee you'll get results.